you talked about blood tests a lot, and that's something that you do. Can you determine if you have a certain condition, whether or not it's specifically related to dental work or that it may be related to another environmental factor?
Pretty much so, yes. However, by the time somebody calls me, they have seen 20 or 30 doctors and nobody can figure out what's going on. Then I know it's dentistry. And I'm going to be right well over 99% of the time. Because if you have a broken leg and you go to the doctor and you got a leg hanging there like that, you don't have to go to 10 doctors to find out, hey, you got a broken arm or a broken leg. Those diseases are very easy to find. But when one doctor says, I'm not sure, but you might have da-da-da-da-da, another doctor says, oh, I think you might have da-da-da-da-da, another doctor says, well, I'm going to try this and it doesn't work, look in the mouth. And the physicians who have worked for me have gotten, every one of them have gotten to the point where I am just so biased that the first thing I do is look in the patient's mouth. So I try to turn that off and try to practice conventional medicine, and I keep running into roadblocks and finally say, all right, open your mouth, and there's the answer. So yes, when it is something that is incurable, look at the mouth. Because there are a whole long line of neurological problems, endocrine problems, organ problems. I mean, when somebody says, you say, well, how are you? And you get an organ recital in return. Pretty much you can count on it being dentistry. Now, I did have one case. This was a learning experience. Where, hey, I know what nickel crowns do, I know what amalgam does, I know what the wrong type of plastic does. I'm getting pretty smart about these things. So this MD calls me and he says, my wife has multiple sclerosis. I used to have multiple sclerosis. I had no use of my left leg whatsoever. And when I had treated 1,000 cases, I wrote a book on it. So, yeah, no, okay. No big deal. So I was in another country at that time. And yeah, bring her up and we'll see if we can't take care of her. So now, I don't have 100% success, but I've certainly got a higher percentage than anybody else has. So yeah, all right. So she comes in, I said, okay, how many amalgams do you have in your mouth? None. Oh, okay, well, how many root canals do you have? None. Did you ever have orthodontics? No. Okay, so I look at an x-ray and it says, oh, you've had your wisdom teeth removed. And she says, no, they never formed. So I'm looking at her husband, the MD, and he's looking at me. And okay. So I said, well, you've had embryology, you know where these structures come from. Yeah, sure, okay. I'm talking to the physician here. I said, well, the tooth comes from two different sources. The enamel, the crown, comes from one source of our genetic material, the root from another. And the root is compatible with bone. The crown isn't, which is part of that eruptive force. Why do teeth erupt and they come up and then quit erupting? Well, there are ways to make it super erupt, but basically they come in and stop right here. Because the root's compatible with bone, the crown isn't. So where these teeth did not form, I suggest the seeds for formation of the tooth are still there, and something genetically turned off those switches, so those wisdom teeth did not form. But the enamel is in there, and the body creates an autoimmune reaction because the crown material, even genetically, does not belong in bone. And that is possibly enough to create the autoimmune reaction called multiple sclerosis. And he says, wow, where did you read that? I said, nowhere. He said, where did you hear it? I said, nowhere. He said, where'd you come up with it? I said, I just came up with it just now because I can't see anything else that would create this disease. And he says, okay, go ahead and clean them out. Now, we're talking about his wife, not him. So I told the dentist, you know, I want these areas cleaned out. And he looked at the x-ray and he said, there's nothing in there. I said, I want them cleaned out anyway. Well, he happened to be stimulated by what I have learned is the most important thing in the world. You know what that is? Money. So I said, tell you what, I'll give you $125 cash American if you will just drill a hole in there and see if it's solid bone or if there's a hole down in there that has all these seeds of development in it. So you do 4 of them, and that's $500. He says, cash? I said, cash. I said, now, if there is a hole in there, then that's a cavitation, which is where a tooth has been removed, but the membrane was not cut out. Those never heal, or occasionally they do, but in the wisdom tooth area, they don't. So you got a pocket full of bacteria in here. So, okay, he does the test hole, starts out, it's just boom, and in the mouth, you fall into something 4 or 5 millimeters, it's like falling into a manhole in the street, you know, you fall into this area. And sure enough, there were 4 areas that were seeds of some kind, some kind of mess in there. And we cleaned those things out, and her MS went away. I mean, obviously we did the healing portion too, but she got over her MS. So I decided maybe we better start looking at these areas where the wisdom teeth never formed. And I kept track for a while, and we found 76 out of 84 that were these little pockets of infection, of autoimmune reaction. Well, that's a high enough percentage that you can't see it on an x-ray, but that's a high enough percentage that, yeah, we're just going to continue to do whole. Because if you drill in and it's solid bone, hey, in a couple of days that's healed over. The patient doesn't have any idea anything was done down there. So what's the risk benefit? Very little risk, a whole lot of benefit, because like with this gal, hey, she got over her MS. What if she'd only had 3 out of 4? She would still have gotten well.